was asked this morning, I would have thought there would have been better preparation in ensuring the opposition got it and my good self. So if we can bear that in mind, because it was given with the urgency that was needed, so a little bit more attention to detail to make sure the speeches shared will be helpful. Right, let us come to the Secretary of State for Health. It's no shaking head, it's one of those things, it's fact. Matthew Hancock.
Thank you very much, Mr. Speaker. With permission, I'd like to make a statement on our action against coronavirus and the decisions we've been taking through the day today to determine the future of the action needed in Leicester. We continue our determined fight against this invisible killer. The number of new cases yesterday was 642, lower than when lockdown began. And according to the latest figures, the number of deaths in all settings is down to 66. We are successfully turning the tide. And part of this success lies in our ability to take action locally whenever we see it flare up. Often, this is on a very small scale, swiftly and quietly, like in an individual farm or factory. But when needed, we also act on a broader basis, as we've done in Leicester. And today I wanted to update the House on the situation in Leicester. At the end of June, we made the decision to close schools and non-essential retail in the city, and not to introduce the relaxations that applied elsewhere from the 4th of July, like the reopening of pubs. This was not an easy decision, but it was one that we had to take. At that point, the 7-day infection rate in Leicester was 135 cases per 100,000 people, which was 3 times higher than the next highest city. And Leicester was accounting for 10% of all positive cases in the country. This decision was taken with the agreement of all local leaders, and I'm grateful to the leader and officers of Leicestershire County Council and to the officers of Leicester City Council for their support and continued hard work. Since then, we've doubled testing in the city, and through a monumental programme of communications and community engagement, we've been pushing our important messages. I committed to reviewing the measures in Leicester every 2 weeks. This morning I chaired a gold meeting of the Local Action Committee to discuss the latest situation. And this afternoon I held a further meeting with local leaders, Public Health England, the JBC, the Local Resilience Forum and my clinical advisors. The latest data show that the 7-day infection rate in Leicester is now 119 cases per 100,000 people, and that the percentage of people who have tested positive is now at 4.8%. These are positive indicators, especially in light of the huge increase in testing in the local area. But they still remain well above the national average and the average for surrounding areas. Thanks to the incredible efforts of people in Leicester, who followed the lockdown, even whilst others across the country have had their freedoms relaxed, we're now in a position to relax some, but not all, of the restrictions that were in place. So, from the 24th of July, we'll be removing the restrictions on schools and early years childcare and taking a more targeted approach to the restrictions on non-essential retail, replacing the national decision to close non-essential retail with a local power to close them where necessary. This is all part of our more targeted approach. However, other restrictions, like those for travel and only having social gatherings of up to 6 people, for example, will remain in force. And measures introduced on the 4th of July, like reopening the hospitality sector, will also not yet apply. The initial definition of the geography covered by the lockdown was a decision I delegated to Leicestershire County Council, and they made and published. The leader of Leicestershire County Council, Nicholas Rushton, has advised me, based on the data and the best public health advice, that he recommends these restrictions now apply only to the Oadby and Wigston area of Leicestershire, as well as the city of Leicester itself, and I have accepted his advice. Some say that the local lockdown is unnecessary. I wish this were true. But sadly, it remains vital for the health of everyone in Leicester and the rest of the country that these restrictions stay in place. We will review them again in a fortnight. I hope that this careful easing of restrictions will provide some comfort to people in Leicester and Leicestershire. And I'd say this directly to people of Leicester and of Leicestershire. I pay tribute to you all. Your perseverance and your hard work has brought real and tangible results, and you've shown respect for one another. I understand this hasn't been easy. Strong representations have been made to me by my honourable friends, the members for Charnwood, Harborough and South Leicestershire, and for the members opposite who represent the City of Leicester. On behalf of constituents who've been impacted, the constituents who've wanted to see the lockdown lifted too, however, there is still a lot to do, and the public health messages remain critical. So please, get a test if you have symptoms. Keep following the rules that are in place. Please, do not lose your resolve, because the sooner we get this virus under control, the sooner we can restore life in Leicester and across the country to normal. Mr. Speaker, this statement also gives me the opportunity to inform the House of an issue relating to testing. We've identified some swabs that are not up to the usual high standard that we expect, and we'll be carrying out further testing of this batch. As a precautionary measure, and while we investigate further, we're requesting that the use of these Randox swab test kits are paused in all settings until further notice. This problem was brought to my attention yesterday afternoon. We contacted settings using these swabs last night and published the pause notice immediately. Clinical advice is that there is no evidence of any harm, that test results are not affected, there is no evidence of issues with any of our other test swabs, and there is no impact on access to testing. Mr. Speaker, our ability to take action on this local level in Leicester is the keystone of our plan to defeat the coronavirus, so we can keep this virus on the run and defeat it once and for all. I'm grateful to you for allowing me to make a statement at this time, and I commend the statement to the House.
Shadow Secretary of State Jonathan Ashworth to reply.
Mr. Speaker, just before turning to Leicester, could the Secretary of State perhaps update the House and comment on Sir Patrick Vance's remarks at Sage, who advised today, or said Sage, I beg your pardon, who at the Select Committee advised that Sage had advised the government to implement lockdown measures as soon as possible on the 16th of March. So why did it take a further 7 days for the government to implement lockdown if Sage was advising on the 16th of March? Can I start by putting on record my thanks to the City Council and all the health officials, particularly our Director of Public Health, Ivan Brown, for all the work they are doing to drive our infection rates down in Leicester. I welcome the extra testing capacity that we have received as a city, including the door-to-door testing, and I want to put on record my tribute to the people of Leicester, the city where I live, for their fortitude in doing all we can to drive this infection down now through 17 weeks of lockdown. If we still have to make further personal sacrifice to keep people safe and hunt this virus down with the lockdown, then so be it. But there is no question there will be a degree of dismay across the city in response to the Secretary of State's remarks. We welcome the opening of non-essential retail, but there are many businesses who were preparing to open their doors for the beginning of July who still cannot open their doors, and they will want to know whether they will get any specific extra business support. The Secretary of State suggested in the previous statement that they would. The Business Minister ruled it out. The continued lockdown coincides with the traditional Leicester fortnight. I don't know if the Secretary of State is familiar with the Leicester fortnight. It's the 2 weeks in July where our schools break up earlier than other schools across the country, and it's a time when many Leicester families will have booked holidays. But of course they can't go on holiday because they're not allowed to, and many travel companies are refusing to pay them compensation and so on. So can he guarantee that they will not be out of pocket because they are not allowed to go on a holiday that they've saved up for all year round? Can the government step in, or can he force those travel companies to reimburse those Leicester families? As you know, Leicester is a city that suffers from high levels of child poverty, insecure work, low pay, lack of decent sick pay. We have many deep-rooted economic problems, and the spike in the city, or the larger outbreak in the city, appears to coincide with these inner-city areas where we know there's high levels of deprivation and overcrowded. We also know we have a large ethnic minority community, so can he explain why he's not yet implemented the recommendations of the Public Health England report into protecting those from minority ethnic backgrounds? And of course, there has been widespread speculation about the garment industry. Can he tell us how many HSE inspections and how many HMRC inspections have now taken place in Leicester's textiles factories, particularly since the Home Secretary a couple of weeks ago promised us she would stamp out any illegal exploitation? We note that he has rejected the advice of the City Mayor of Leicester to partially ease restrictions in parts of the city, although he's taken advice from the leader of Leicestershire County Council to ease restrictions in part of the county. Could he perhaps explain what the public health evidence is behind that decision? Because if the public health advice is to maintain, for example, the lockdown in the west of the city, when we know the infection rates are at their highest in the east of the city, why does that not advice also apply to the neighbourhoods that border the city boundaries? This is one greater urban area. So what is the public health reason why someone in one side of Gilmorton Avenue, I don't expect him to know Gilmorton Avenue in my constituency, but it illustrates the point. What is the public health reason why when someone living on one side of that avenue is now subject to restrictions because they fall under Leicester City Council, but they presumably are not allowed to cross the road now to speak to their neighbour who lives opposite them because they fall under Blaby District Council? There are other examples across the city as well. So if you could offer us that advice, I think we would appreciate it. Now, of course, Leicester went into lockdown because of the infection rate and because it took so long for us to get us the specific data. Local authorities are still complaining that they are not getting the patient-identifiable data, and they are not getting data on a daily basis, and they are not getting contact tracing data. The Prime Minister yesterday at Prime Minister's Questions said we have a world-leading system, the best system in the world with testing and tracing, and it will avoid a second spike this winter. But we know there have been problems with this testing and tracing throughout. Last week it was revealed that he's been overstating the test numbers by 200,000. Sky News revealed that. Today he's come to the House, and we're grateful for him updating the House about what's happening with Randox. I believe this is a £133 million contract that was given to Randox without any competitive tender. Could you just explain what is exactly wrong with these kits? How many of these presumably faulty kits have been used? Is there a health risk to anyone who has been tested with these kits? And how many? I'm putting myself in the second position. There isn't a health risk. The government are withdrawing these kits. And how many people have these unsafe kits been used on? And why wasn't the certifications checked before these kits were used? These kits tend to be used in many care homes. We want care home residents to be tested regularly. We want care home staff to be tested regularly. Can he guarantee that those care homes will now get alternative kits rapidly? And just finally, today we've seen the broader testing, more testing data has come out today. The Prime Minister promised that tests would be delivered within 24 hours by the end of June. I think the figures today show only 66.9% of them are. On the tracing data, we see that only 71% of people are being contacted, not the 80% that we were promised. And isn't the truth that we've got swabs being recalled, we've got contact tracing data not meeting the targets, we've got circle call centres with people not doing anything, and it's all costing 10 billion, and he's now bringing in Mackenzie's. Why is he throwing good money after bad? Why doesn't he invest in public health services, primary care and local health teams instead to do this testing?
Mr. Speaker, the right honourable gentleman has spent weeks complaining about capacity to do things like contact tracing, and now complains that we've got too much capacity. And I think he should decide on a position and stick to it. On the point on certification, on Randox and the kits that we put a pause on, the reason is that they had a CE stamp, and upon investigation of the certification of that stamp, the certification was not forthcoming, and therefore physical checks were done, and we found that the swabs weren't up to the standards that we expect. This is limited to the Randox element of the testing system, not the broader testing system that we have. And I explained the clinical position, which is that there is no evidence of any harm having been done, and that there is full access to testing because we have plenty of other test kits available. He asked about test and trace. 99% of the tests that are done, that need to be done quickly, are returned the next day. He asks about more broadly about the comments of the Chief Scientific Advisor to the Select Committee. Of course, the 16th of March is the day when I came to this House and said that all unnecessary social contact should cease. That is precisely when the lockdown was started, and so I'm glad that it's unusual to be attacked for saying exactly the same as the Chief Scientific Advisor. On the questions with respect to Leicester, he rightly raises the Leicester fortnight, and schools have effectively risen for the summer in Leicester already. Of course, I would urge holiday companies that people in Leicester have booked with to reimburse people in Leicester who might have booked a holiday at this point. He mentions the problem and the challenges of insecure work in Leicester. He's absolutely right to do so. This is a very long-standing problem. I think we, across the whole House, would strongly support action to ensure that illegal, insecure work is stamped out. My colleague, my right honourable friend, the Home Secretary, is taking action where that is appropriate. But of course, the public health response is vital. Finally, he asked about the public health advice on geography. Given that there were no cases in many areas of the county that are part of the conurbation of Leicester over the last week, it was, I think, a reasonable recommendation to me by the County Council to lift the lockdown in those areas. I gave the Mayor of Leicester the opportunity to put forward any changes he might have wanted to within the city boundary, but he declined to do so. And I think, based on public health across the whole city of Leicester, within the city geography, incidence of this disease is higher than a sustainable level, and we absolutely need to bring it down. And that's the basis on the advice and working with and listening to local leaders that we took the decision of the geography of the lockdown in Leicester. And I finally end again by paying tribute to people in Leicester who are enduring this lockdown longer than others. It is their fortitude that will help get their city safe again.
We're now heading to the Chair of the Select Committee is Jeremy Hunt. Jeremy Hunt.
Thank you, Mr. Speaker, for special dispensation to ask this question remotely. I want to ask the Health Secretary about the worrying variation in coronavirus mortality rates between hospitals, which appear to range from 12.5% to 80%. Now, there may be some issues of deprivation or ethnicity, but some of that variation is likely to be a failure in some hospitals to adopt best practice, which is what the Getting It Right First Time programme led by Professor Tim Briggs does. So I wonder whether he would agree to meet me and Sir Tim to discuss whether the Getting It Right First Time programme could help reduce COVID mortality rates going forward.
Mr. Speaker, I'd be very happy to meet my right honourable friend and Professor Tim Briggs, who does an incredible job. He's a brilliant public servant who's done great work on the Getting It Right First Time programme. As my right honourable friend knows better than almost anybody, the unjustified variation in performance between different hospitals within the NHS is a huge issue across the board, because if the standards in every hospital were the same as the standards in the best hospital, the performance of the whole would be so much higher. That is exactly what the Getting It Right First Time programme was designed to deliver. It was instigated by my right honourable friend, and I'd be very happy to listen to what both he and Professor Briggs have got to say.
Let's head to Scotland and visit the SNP spokesperson, Dr Philippa Whitford. Dr Whitford.
Thank you very much, Mr Speaker. Directors of Public Health in England are still complaining they're not getting the information they need. They only started to get area data from late June, when it became clear that Leicester had had 900 cases in less than a month. Within a week, Leicester was back under lockdown. The Prime Minister has described this as his whack-a-mole approach to controlling COVID. But does the Secretary of State recognise that for the people of Leicester, this has felt just as bad as the national lockdown? I've raised many times the issue of test results from the UK government labs not being sent to GPs or local public health teams. Is it true that this was not even specified in the contract? Even after Leicester, and despite COVID being a notifiable disease since the 6th of March, local authorities and health protection teams in England are still only being sent anonymised area data, which is of little use to identify clusters. And it's only being sent on a weekly basis, which is far too slow. Does the Secretary of State not accept that public health teams need daily data with both work and home postcode details so they can spot an outbreak? And they need individual test results so they can isolate all those involved to break the chains of infection and prevent further spread of the virus. I know he rarely mentions isolation, but surely the Secretary of State knows it's actually isolation that breaks the chains of infection. But this should be the affected individuals, not a whole society or a whole city. The Test and Protect system in Scotland has been up and running since the end of May and was able to disrupt a cluster of just 12 cases in the south of Scotland. That's the level of detail required to drive an elimination strategy. He says local lockdowns will be the cornerstone of his ongoing strategy, but how does he plan to deal with the social and economic impacts? And will he not join the devolved and Irish governments in following an elimination strategy to avoid repeated local lockdowns? When does he envisage having a fully functioning test, trace and isolate system in place across England?
Mr Speaker, I'm terribly sorry I'm not going to be able to answer all of the points that were made, but all I can say to the Honourable Lady is that I'll send her an update on the data that in England local directors of public health get, because there's been a huge amount of progress since many of the situations that he described. I bow to no one in my desire to use data to make policy and to get the best data out, and we've been getting better and better and better data out to local areas. We've been publishing more and more and more data, and many of the comments that she made were out of date.
Richard Dolphin.
Thank you, Mr Speaker. Out there in the country, confidence that we have a clear path out of the global coronavirus pandemic is absolutely key, and confidence that the government will take the right but necessary and sometimes difficult decisions for us all is also key. And I think we've seen some of that today with these two decisions that the Secretary of State has taken. On behalf of my constituents, can I thank the people of Leicester for the perseverance that they are showing. But will the Secretary of State assure me and my constituents in North West Durham, in fact the whole country, they will not hesitate to take similar decisions like local lockdowns if necessary in the future?
Yes, of course, Madam Deputy Speaker. The need for local lockdowns is one that we don't ever want to have to bring in, but it is important as a tool in our armoury to be able to tackle outbreaks where we find them. I much prefer local action to be on individual specific, whether premises or an individual surgery or in a more targeted way. I also pay tribute to Blackburn with Darwen Council who have done a very good job of bringing in local measures when they saw their numbers going up before they got anywhere near to where Leicester got to, and the local council there have done a terrific job. So it is absolutely vital that we have this local action and that we take this local action, and we won't resile from taking it. But having said that, we also recognise the impact that it, of course, has on the people and the businesses involved.
Munira Wilson.
Thank you, Madam Deputy Speaker. Today, Sir Patrick Vallance told the Science and Technology Committee it's clear that the outcome has not been good in the UK. I think you can be absolutely clear about that. So whilst I'm delighted that the Prime Minister committed to my right honourable friend, the member for Kingston Surbiton yesterday, that we will have a future independent inquiry, we need to learn lessons urgently now ahead of a second wave, not least following the warnings in the Academy of Medical Science report earlier this week that suggested we need to rapidly improve test and trace capacity and our PPE resilience. So will the Secretary of State tell the House today what is he doing to make sure we learn from our mistakes?
Secretary of State.
Madam Deputy Speaker, we're learning all the way through about how best to respond to this virus. And in fact, changing measures, such as the changes that we've made in Leicester today, are a good example of learning from the progress of the virus, learning about how best to tackle it. And that's just one of a myriad of ways in which we're learning and improving all the time.
Chris Bryant.
I want to ask the Secretary of State about the revelations that the Americans and the Canadians have come up with in relation to Russia trying to break into the vaccine testing regimes in their country and possibly in the UK as well. How secure are we ensuring that these the vaccine process is in the UK from cyber attack from elsewhere? And is there anything further that we need to do to make sure that other countries aren't looking on this as some kind of stupid competition? We're all in this together, aren't we?
Absolutely. Our approach is that the vaccines that are developed in the UK, supported by UK government and ultimately UK taxpayers' money, are there, of course, to provide protection should they come off to the UK population, but so too to the population around the world. And we're using our ODA money to help ensure that there's broad global access should they work. With respect to the question about cybersecurity and potential hacking, he'll understand why I can't go into full details, but I can reassure him that the National Cybersecurity Centre is taking this very seriously.
Sir Bernard Jenkins.
Thank you, Madam Deputy Speaker. Can I return to the question of public confidence? And can I thank my right honourable friend for the tireless way that he submits himself to scrutiny by parliamentarians and the press? But will he accept that the public does want to understand more clearly what mistakes were made and what lessons have been learned? And can I invite him perhaps to at least table a written ministerial statement before the rising of the House next week that sets out the key lessons learned and how they are being implemented as we go into the autumn, which could be another very testing time for our country?
Well, I'm very happy. I'm very happy to do that. I wouldn't deny the chair of the liaison committee his wishes in that, and I'm looking forward very much to appearing before the Science and Technology Committee next week to answer any questions that they might have.
Stephanie Peacock.
Thank you, Madam Deputy Speaker. What does the Secretary of State say to the man in Barnsley who, when asked if he was contacted by Test and Trace if he would isolate, he said no? When asked if he got COVID symptoms, he would isolate. He said he'd have to think about it, but probably not. And when asked why, he said because if he doesn't go to work, his kids can't eat. This is the stark reality for many people in this country. So what is the government doing to make sure that people have the financial support so they can follow the government guidance?
Yes, the Honourable Lady asks an important question, and it's a question that we address by ensuring that there is local support available, in particular when there's a local lockdown, and of course there's the statutory support that's available, and good employers will ensure that people are supported. Our overall principle is that people shouldn't be penalised for doing the right thing, and the thing I'd say to him is please get the test, and if you're asked to isolate, and make sure that you seek the support that's available.
Nigel Mills.
Many of my constituents are a little confused where they'll have to wear masks in public places from next week. So could he just confirm once and for all, if they go to fetch a takeaway, will they have to wear a mask or not?
Madam Deputy Speaker, if people go to a shop, then it will be mandatory from the 24th of July to wear a mask. If they go to a hospitality venue, then it will not.
Dr. Lisa Cameron.
Many thanks, Madam Deputy Speaker. As Chair of the Disabilities Party Parliamentary Group, I'm concerned by results from charity Scope, who have undertaken research showing 1 in 5 adults with disabilities have said they will not leave their house until a vaccine for COVID is developed, and just 5% said they'd feel safe when shielding is paused. So what steps will the Secretary of State take to ensure people with disabilities are protected, but also given confidence to resume their lives after lockdown, so they don't slip further into social isolation and loneliness?
Madam Deputy Speaker, the Honourable Lady raises an incredibly important point and has raised this point rightly before. And it's so important that, especially as we lift the shielding measures at the end of this month, the people who have been shielding have the confidence to know that the reason we're able to lift those measures is because the rate of transmission of this virus is so much lower now, and that it is safe. Indeed, it is recommended that they go out and about. And there's many charities, including many who we've funded through this crisis, who are available to help and to support people in these circumstances. She's right to keep raising this issue, and we must keep working on it.
Rob Butler.
Thank you very much, Madam Deputy Speaker. Can my right honourable friend assure me that lessons will be learned from the experience of the councils in Leicester and Leicestershire, to whom he has rightly paid tribute, to ensure that all local authorities, including Buckinghamshire Council, receive all of the detailed information that they'll need from his department in the form and time frame that they need it, so they can then take action to protect their local populations?
Yes, Madam Deputy Speaker, and my honourable friend has raised this point with me both privately as well about access to this data. It is incredibly important. We're constantly improving the data that's available because we're constantly getting better data. That is an important part of the work strand.
Janet Davey.
Thank you, Madam Deputy Speaker. We cannot praise enough carers, key workers and NHS staff during this pandemic, and of course in Leicester. My constituent, Anthony Francis, launched a petition for a national day of recognition for our NHS and key workers. He proposes the 26th of March, which was the first day of Clap for Our Carers. The petition reached over 100,000 signatures from across the country. Will the Secretary of State commit to this?
Well, I'll certainly look at it. It seems like a very interesting idea. I think Clap for Our Carers was a absolutely brilliant initiative. I love the fact that it was essentially it was a social initiative. It didn't come from government. We embraced it enthusiastically and all went out clapping, as did everybody. And a way to mark that permanently is something that I'm absolutely open to.
Angela Richardson.
Thank you, Madam Deputy Speaker. On Monday morning, I will be attending the opening of the brand new Guildford ward at the Royal Surrey, a 20-room, fully equipped with CPAP isolation ward built in just 4 months. Will my right honourable friend join me in congratulating both the pragmatism shown by the local council and the forward planning of the hospital? And does he agree with me that in the event of a localised spike in cases requiring hospitalisation, the Royal Surrey will be well placed to deal with it effectively?
Well, yes, Madam Deputy Speaker. My honourable friend is a great champion of the Royal Surrey at Guildford, and that the hospital has done a brilliant thing by, in short order, expanding its capabilities in this crisis, as have many other hospitals around the country. One of the positive things that's come out of it has been the dynamism and flexibility of parts of the NHS and their collaboration with the local authorities, and both of those have risen to heights never previously seen. I hope that we can bottle that best practice and make sure that we keep a dynamic, flexible NHS that works collaboratively with local authorities along into the future.
On Speller.
Thank you, Madam Deputy Speaker, and I accept that today we do have to have a focus on Leicester, but can I revert to the general? And can I ask the Minister during the recess to prepare a national plan for recovery to announce when we reconvene in September? And does he accept that we may have to face up to the fact that we have to contain, but we may have to coexist with the virus? Because we are facing, over the summer, a tsunami of job losses and business closures, and we will have to get Britain back to work.
Well, the honourable gentleman is absolutely spot on in highlighting the two vast challenges that this country faces, that every country faces, which is an unprecedented health challenge and an unprecedented economic challenge as a consequence. Both of these are extraordinary, and the rising to each of them and making sure we deal with each of them as best we can is at the heart of every single government across the world.
Peter Boone.
Thank you, Madam Deputy Speaker. Can I congratulate the Secretary of State for coming to the House first and updating us on the situation in Leicester. This week there was a report from the Centre for Social Justice saying that we have 100,000 modern-day slaves in this country. Now, it appears that many of those are in Leicester and have unfortunately created this high infection rate. What is the government going to do to look into this matter, and if this is happening, clamp down very hard on the people that are causing it?
Madam Deputy Speaker, the allegations that the honourable member makes are ones that have been widely made and are widely understood to be a potential part of the problem. I speak carefully in terms of the language because I know that there's ongoing operations both to deal with the public health problem and to deal with other illegality. And this is a sore that has long gone untreated and undealt with in Leicester, and it is absolutely vital that we add national resources to make sure that we get to the bottom of this problem in Leicester once and for all, both the public health response and dealing with some of the potentially illegal employment practices that many people have raised.
Jim Shannon.
Deputy Speaker, first of all, can I thank the Secretary of State for his statement on the health update for Leicester. In relation to masks, I fully understand the need to wear a mask when you travel on a bus or a train or a plane, as I do twice a week here, and as everyone else who travels that I've seen also adhere to. But there is uncertainty in wearing a mask, and that is now pervading the discussion, and there is uncertainty, so we need to bring the general public with us. So does the Secretary of State not agree that the government message on masks must be clarified, as many people are questioning the appropriate time and the appropriate place to wear a mask?
Madam Deputy Speaker, it is going to be, by the 24th of July, mandatory to wear a mask in a shop, on public transport and in any NHS setting, and then it is recommended in a broader set of settings. That's based on medical advice, and also on the judgment that we want to also bring confidence to people that they can and should go shopping, precisely because of the economic benefits that brings that were raised just a moment ago.
Andrew Percy.
Speaker, medical nutrition has been vital for the treatment of COVID patients in hospital, but it's also vital for those requiring to be fed by tube at home. During this period, GPs have not, due to them working remotely, been able to use the electronic prescription service in the most appropriate way. That has meant that many of the providers of medical nutrition have run up huge prescription debts. That's a risk for the future. So will the Secretary of State look at what can be done to ensure that the supply of these vital medicines can continue?
I'm very grateful to my old friend for raising this question, because it's important, but also because in many places the electronic prescription was absolutely vital to getting through the COVID period. So I want to know of the examples that he raises where that has not been able to be used during the crisis, because in fact using this sort of digital technology has been part of the way that we've got through it in many parts of the country.
Sam Tarry.
Madam Deputy Speaker, Leicester's Director of Public Health said that getting the information needed about the outbreak in Leicester, data and so forth, has been particularly challenging. And this is of interest, particular interest to my constituents in Ilford South, given the demographics of Ilford South, very remarkably similar, large ethnic minority populations, many South Asian constituents. And as we know from the recent Public Health England review, we've seen a disproportionately number of deaths from COVID-19. So I'd like to know directly from the Secretary of State, what's he doing to get Leicester the information and data they need, but also every borough, including mine in Redbridge, that information as well?
This is incredibly important, and as I said before, I bow to nobody in my enthusiasm for using data to inform better decision making. Hence, we've been constantly improving the data that's been available, both at a national and at a local level. And there's now very sophisticated systems in place to ensure that the Directors of Public Health can get that information. And we're constantly improving the information that's available, both for those who have statutory duties and have signed data protection agreements, who can have access to much more information, and of course publicly, where it doesn't give away confidential information about individual people.
Sir Graham Brady.
Thank you, Madam Deputy Speaker. The Secretary of State, I know, is working on a package of support for care homes with an unusually high rate of vacancies due to a lack of applications at the moment. But can I impress upon him the situation is becoming desperate for some. In Trafford, the number of vacancies is now 160. A week ago, it was 147, an increase of nearly 9% in a week. Can I ask him to give those homes some hope by communicating when they can hope to hear about the support package?
All I can tell my right honourable friend, who has pushed on this point repeatedly, is that this is vital and ongoing work inside government.
Barbara Keeley.
Thank you, Madam Deputy Speaker. The fourth annual Leader report on the deaths of people with learning disabilities was published today, and it showed that people with learning disabilities continue to die prematurely and from treatable causes. And since March, nearly 40% of the deaths notified to the Leader process were linked to COVID-19, and that compares to a quarter of all deaths in the UK. Now, this is a group of people who've been let down by our health and care services, who died 22 years before their peers and are now dying disproportionately from COVID-19. Will the Secretary of State look urgently at the 10 recommendations in the Leader report and consider what can be done to reverse this tragic loss of decades of life for people with learning disabilities?
Yes, of course, it's an incredibly important report that she rightly references, and a system of annual reports that we brought in precisely to bring these things to public attention. I'm glad that it also be able to report that the number of people with learning disabilities and autism who are in secure settings has fallen quite significantly over the past few months as well. It's a connected area that I know that the Honourable Lady takes a great interest in.
Dame Cheryl Gillan.
Madam Deputy Speaker, can I offer my support to the Secretary of State, who's been working tirelessly during this crisis. Epilepsy Society is a major charity based in my constituency, and they say that people with epilepsy are affected adversely by COVID-19, particularly as the fever associated with coronavirus can trigger an increase in the number of seizures and cause breakthrough seizures. Despite this, the Secretary of State will know that people with epilepsy are not classified as clinically vulnerable for coronavirus or the flu. So in fact, they do not qualify for either the free flu vaccine or any future COVID vaccine. Will the Secretary of State look into this and ensure that this is remedied as soon as possible so that we can protect this very valuable cohort of people?
Madam Deputy Speaker, my right honourable friend is an incredibly strong voice for those who suffer with epilepsy, and what I can commit to her is that I will ensure that the clinical decision makers who make the recommendations on the order of priority for any vaccine, both flu and coronavirus, take a specific look at the latest evidence on epilepsy. I cannot give her the guaranteed assurance that she seeks, because these are rightly decisions that are taken on the basis of recommendation from clinicians, and I wouldn't want to break that principle because it's a very important principle. But what I can do is ensure that the latest information, including on the impact of coronavirus on those with epilepsy, is taken into account in the decisions.
Now, just before I call the next person, let me appeal for quick questions, not statements. And then if the questions are quick, the Secretary of State, who's been most assiduous in answering thoroughly, will be able to give quicker answers. Neil Hanvey.
Thank you, Madam Deputy Speaker. A learning culture is the hallmark of any robust patient safety strategy. Being able to own, reflect on and learn from past errors is a defining characteristic. Across health and social care, that tone is set by the Secretary of State himself. So when concerns such as those of Professor John Edmonds about the loss of life relating to the timing of lockdown are raised, it behoves him not to be dismissive, but to take them seriously. How can clinical staff and the wider public have confidence in his leadership when they can readily fact-check that his assertions were wrong?
That's a bit of the last bit was a little bit broad. I mean, not all my assertions have been wrong, but I do learn and try to learn, and indeed have discussed openly some of the things that went badly as well, and wrong judgments, as well as things that have gone well. I've referenced, for instance, the fact that when we first brought in guidance around funerals, it had the impact of too many people staying away, spouses who might have been married for 50 years, and we changed that, and that was an error. So absolutely the learning culture is important, and it is important that it's set from the top, and I'm very happy to be open about the errors that I and others, I've made. Others can be open about their errors, and let us learn. But I also think it's important to be robust where you think you've made a decision correctly.
Heather Wheeler.
Thank you, Madam Deputy Speaker. Will my right honourable friend commit to using the experience of what's happened in Leicester to inform future measures in other areas, with particular ruling on what essential workers should be able to keep working with all the appropriate safeguards, such as our high-class engineering companies in South Derbyshire or elsewhere?
Secretary of State.
Yes, and in fact it links to the previous question, because one of the things that we learnt from Leicester is that we had the power to be able to close non-essential retail across the city. We have now, we will now take the power to enable the local council to close non-essential retail where it is necessary, and therefore take a much more targeted approach. This allows us to fight the virus, but with a lower negative impact on business. So we're constantly seeking to improve the tools at our disposal, in this case legislative tools at our disposal, in order to fight the virus.
Zara Sultana.
Thank you, Madam Deputy Speaker. This afternoon, the Government's Chief Scientific Advisor revealed that the SAGE Committee urged the Government to impose a lockdown on the 16th of March. A week before it did, the Secretary of State has just suggested that he responded by advising people to practice social distancing on that date. But advising people to socially distance is not the same as imposing a lockdown. That week-long delay could have cost thousands of lives. So I asked the Secretary of State, why did the Government fail to act when SAGE called on it to? And does the Secretary of State regret this delay?
She's trying again. The front bench opposite said this. On the 16th of March, I said to this House, and it was welcomed by the front bench opposite, today we are advising people against all unnecessary social contact and with others and all...
Order! Don't shout at the Secretary of State. He's answering the question. Secretary of State.
Thank you very much. What I said on the 16th of March was, today we are advising people against all unnecessary social contact with others and all unnecessary travel. That is when the lockdown truly started.
Alicia Kearns.
Thank you, Madam Deputy Speaker. I'm grateful to my right honourable friend for the actions he has taken, which have isolated the virus and protected nearby areas like mine in Rutland and Melton. On behalf of our neighbours in Oadby and Wixton, can my right honourable friend confirm these decisions are being made based on scientific data and that the city and county councils have a significant voice in the decision-making process?
Yes, absolutely. The decisions that we've taken in Leicester are based on the data, based on the best public health and scientific and clinical advice, and in consultation with the local leadership, and hence the decision to ask the advice of the local leaders in terms of the geography of coverage, and make sure that their insight, that we asked for their insight. And as I said in my statement, I accepted those recommendations. As we've seen right across the country in local action, councils have got such an important role, just like we've seen in Blackburn and Darwin, where they took the initiative themselves to take the action that was needed. I pay tribute to what the council did there, because I hope it will stop that their council area getting into the position that Leicester got itself into.
Afzal Khan.
Thank you, Madam Deputy Speaker. It was shockingly clear at the PMQs this week that the Prime Minister had not read the report commissioned by his government on the worst-case scenario for a second spike of coronavirus that suggests upwards of 120,000 hospital deaths. Given the seriousness of this report, can the Secretary of State confirm that, unlike the Prime Minister, he has read it, and what steps he is taking to implement the recommendations of the report to prevent a catastrophic second spike of the virus?
The report was an incredibly important report in making sure that we look at we cast ahead and look at all of the challenges that face us ahead of us, but it took the assumption that there would be no action from government should the R go to 1.7. But it's the stated policy of the government not to allow that to happen. And so whilst it was a worst-case scenario based on a set of assumptions, we are constantly vigilant.
Dr. Luke Evans.
Thank you to the Secretary of State, and I appreciate his answer to several of his questions about the learning that he's done, because 10 days ago I asked him about information. For the people of Hinckley and Bosworth who live in Leicestershire, they want to know where the boundary is and what the implication is of any changes. Would he be kind enough to point out exactly where that boundary is, and for the people who are now out of lockdown, what that means in the measures they are taking, so there is a clear message that they can take home tonight?
Very happy to give that answer, which is very clear. For those who are in the City of Leicester and in Oadby and Wixton, then the measures that are set out, releasing on the 24th of July the closure of non-essential retail, releasing the closure of schools and childcare facilities, but keeping all of the other measures in place, that is the position. For those who are not in those two specific areas, they return to the same measures that the rest of the country is living with, except, of course, that we'll keep the higher vigilance, the higher testing and the communications in those areas. And the decisions on this geography was taken on the advice of local council leaders. I've seen, whilst I've been on my feet, that the Mayor of Leicester has made some comments around this. I did ask him if he wanted to put forward a different geography within the City of Leicester, and he declined to do so. But we work very hard, as closely as we can, with Leicester, and especially with the public health officials in Leicester, who are doing an absolutely valiant job in difficult circumstances.
Wes Streeting.
Thank you, Madam Deputy Speaker. On lessons learned, given the circumstances in Leicester, does the Secretary of State for Health agree that the government made a terrible mistake in cutting the Health and Safety Executive's budget by 48% and by instructing the HSE to reduce inspections in the textiles industry by a third?
I haven't seen those figures, but what I do know is that local councils have an incredibly important responsibilities in this space, and we will now act. We will now act to make sure that we tackle some of the challenges that we find, especially in Leicester.
Jane Hunt.
Thank you very much, Madam Deputy Speaker. I welcome the targeted new approach to business closures in the local lockdown area. However, the current lockdown has affected businesses both within the lockdown and outside the area, because people have decided not to open for fear of an unmanageable number of people coming to their establishment. Can the Secretary of State look to offer additional support for these businesses?
Well, the support that's available nationally to businesses, which is incredibly generous, is of course available to those outside the areas in question. I do understand the impact on businesses, both of course within Leicester, but also more broadly. And all I can say is that that national support is available to all.
Rachel Maskell.
Thank you, Madam Deputy Speaker. Over the last few weeks, I've exposed the significant risks of COVID-19 in some of York care homes. These findings have wider application. Measures in the Coronavirus Act, poor decision-making and poor governance have undoubtedly led to increases in infection and mortality. And there are serious questions over the recording and reporting of deaths. Will he or one of his ministers urgently meet with me before the recess to discuss these tragic findings so lessons can be learnt and lives saved?
Very happy to ensure that the Social Care Minister meets the Honourable Lady as soon as possible.
Greg Clark.
Thank you, Madam Deputy Speaker. The Secretary of State is assiduous and energetic in making himself available to answer questions at all times, and I'm grateful that he's agreed to come before my committee next week so that we have longer than we would have had today given this statement. In March, we didn't have the testing capacity in place to cope with the volume of testing that was needed, and it took until May to get it. Sir Patrick Vallance has said to the Science and Technology Select Committee this afternoon that we don't currently have the testing capacity needed for the coming winter. So will the Secretary of State guarantee that it will be available long before then, and that we don't repeat one of the principal mistakes of the current pandemic?
I was heavily and personally involved in making sure that there was that rapid increase in testing capacity back then, and I'm absolutely determined to ensure that the testing that we need for this winter is available. We have plans in place to deliver it. Of course, that needs to be built. It isn't there now, but it will be built. Even if there are no breakthroughs on testing technology, which will make testing much easier to access, even if there are no breakthroughs, we have plans to ensure that the testing capacity that's necessary for winter will be available by winter.
Andrew Gwynn.
Thank you, and can I thank the Secretary of State for his statement. We know there are distinct areas of the country seeing local rises in cases, so can he explain what urgent steps the government are taking to increase testing in these areas? And with indulgence, as someone who's on week 17 of long COVID viral fatigue, can I also ask the Secretary of State what additional resources he's committing to NHS support services for those who are bluntly struggling to recover from the virus?
Deputy Speaker, I'm very sorry to hear that the Honourable Gentleman is suffering from post-viral fatigue. It is a very significant problem for a minority of people who had coronavirus, and my heart goes out to him because I know how debilitating it can be. I'm glad to say that we have brought in an NHS service, and I'll make sure that he has access to that service, as should anybody who's suffering from the symptoms of the fatigue that comes to some. And also I've put just under £10 million into research to make sure that we get the best possible treatment. It's an area that's very close to my heart.
Angus Brendan McNeill.
Thank you, Madam Deputy Speaker. Taplev. At his statement on July the 7th, the Secretary of State agreed with me that 80% of positive cases are asymptomatic, and he would use capability for testing of asymptomatics. Now, unless we patrol for the virus today, it is Leicester, but tomorrow it will be somewhere else. And one serious gap for many communities are workers returning from, as merchant mariners or oil rig workers. Now, people are mostly routinely tested going on to oil rigs, but routinely are not tested coming off oil rigs. And I know of some oil rig workers who have tested positive, having taken tests for various reasons when they've come off. Now, I wonder if you will commit that returning mariners, and especially those coming off oil rigs, are tested, because we know that there's a danger and a gap we've got left open that unchecked people may be unwitting asymptomatic coronavirus carriers. And can you do something to close this gap, please?
To look into that, we have a number of surveys to find out where are the highest risk groups by occupation, and to put in place asymptomatic testing to address that risk. Of course, many oil rig workers come ashore in Scotland. The UK testing capability is significant on the west coast of Scotland, in Inverness, in Aberdeen, and elsewhere, and I'd be very happy to work with my counterparts in the Scottish Government to test the hypothesis that he proposes.
Felicity Buchan.
Thank you, Madam Deputy Speaker. Will my right honourable friend update the House as to the steps Public Health England is taking to ensure that we are ready in the winter time if there is a second spike?
Madam Deputy Speaker, my honourable friend is quite right to ask about this, but it's not just Public Health England, it's right across the board taking steps in the NHS, taking steps in test and trace to grow capacity in contact tracing and the testing that our right honourable friend just asked about, making sure that, for instance, we need to know that the capacity is there right across the board. And Public Health England have their responsibilities, but so do we all.
Ilya.
Thank you, Madam Deputy Speaker. And I'm delighted that the Secretary of State for Health is so keen on data. My local CCG tells me that they're still not getting the right data to GPs. It's quite clunky, and they think, and they're right, I think, in saying that GPs can see comorbidities, so it's particularly important they get data about people who've been tested. And we have an outbreak in the north of my borough now, and we don't yet have the full postcode data. So we have the postcode data, rather, but not the full address. This is isolated to households, and it will stop local lockdown if we can actually help get that very, very precise location. Surely the track and traces are getting that data. Can they get that to local authorities so we can handle this locally?
I will personally ensure that all of the data that we have on her borough is made available to her borough, subject to a data sharing agreement, which I think is in place with Hackney, so that they can best address this. It may be that we don't have data that is being sought, in which case we can. It will be straightforward and open about that, but also we might want to have a discussion about whether we can get any further data that's necessary.
Andrew Bridgen.
Thank you, Madam Deputy Speaker. Can I commend the Secretary of State, the Department of Health and the people of Leicester for their heroic efforts to suppress the virus in the city and prevent widespread further infections across the country. However, can my right honourable friend comment on the levels of support and cooperation he believes these vital efforts have received from the Leicester Mayor Sir Peter Salisbury and from the Labour-controlled City Council?
Madam Deputy Speaker, we have been working very closely with the City Council. The officers of the City Council have been doing a heroic job. I just think that it's best if everybody pulls together and everybody tries to come together to tackle the virus. Given that we've involved local leaders in all of the critical decisions, indeed, I think it's best if people just try to stay on the same page as much as is possible, no matter how hard some people seem to find that.
Christine Jardine.
Very much, Madam Deputy Speaker. Secretary of State, two of the recurring themes today from your statement have been people asking that we...
Order, even at this late moment. Would the Honourable Lady please address the Chair, not the Secretary of State? Please.
I do apologise, Madam Deputy Speaker. Would it be possible, as we look at the lessons that we learn from the first wave of this and the threat of a second wave, and the fact that the British public have been so keen to thank those working on the front line, we've talked earlier about the clapping for the NHS, would the Secretary of State consider using his influence with the Home Secretary to offer those migrants working in health and social care in this country the right to remain indefinitely?
Thank you very much, Madam Deputy Speaker. Well, absolutely, we enormously value all those who work in health and social care. And just this week, I was able to say that the exemption from the immigration health surcharge has extended right across right across those who work in health and social care. And I think this demonstrates the value that we place on them.
Finally, Robin Miller.
Thank you, Madam Deputy Speaker. My sympathies are with the people of Leicester. In North Wales, we continue to experience the low levels of infection that characterise a flat-topped curve while containing local workforce outbreaks. And I put my thanks on record for the care workers and staff at Betsy Cadwallader Health Board for tackling the different challenges this kind of outbreak presents. History teaches us great tragedies present opportunities for innovation. The Great Fire of 1666 gives us the origins of our fire service and modern insurance. Can my right honourable friend give us any hope that any advances will come from this tragic pandemic?
Madam Deputy Speaker, I am a man who is an unashamed optimist, and it's difficult sometimes to be an optimist in the middle of a global pandemic. But I'm glad for the chance to answer my honourable friend's wise question with some enthusiasm, because we have, amidst this great tragedy of this pandemic, seen some big steps forward. The use of telemedicine and improved access to medicine for so many people by use of technology is one example. The advance and the march of British science, which has led the world in terms of the development of the discovery of the first drug known to reduce the impact of coronavirus, but also across the board in terms of the scientific work that's gone on. I talked earlier about the flexibility and the system working in the NHS, which have got to be the hallmark of the future of our NHS. There's just three examples off the top of my head, but there are myriad others. And amidst this dark cloud, Madam Deputy Speaker, when we see a shard of light, we must take great hope from it.
Thank you.
I beg to move that this House do now adjourn.
The question is that this House do now adjourn. Jim Shannon.
Thank you, Madam Deputy Speaker. First of all, I'm going to say what a pleasure it is to have you in the chair on a subject matter that I know that you have great interest in, Deputy and Madam Speaker. I'm also very pleased to have an adjournment debate. I usually intervene in adjournment debates, but on this occasion I've actually got the adjournment debate, so I'm very, very pleased to have that. I want to put on record my thanks to Mr. Speaker for making it possible. I know that's due to his forbearance and interest in this matter, and when I spoke to him about it